Okay, we're going to go ahead and get started. Anyone who rolls in late, we will let them in. Couple of logistic things. If you have questions, comments, concerns of any kind, drop them in the chat. We'll get everything answered at the end. And then please stay muted just so we can diminish any background noise for the recording that will be uploaded and sent your way tomorrow. I think we're ready to rock. So hello everyone catching recording or with us live. My name is Jen Morgan. I am the owner of Centrality Physical Therapy and Wellness, and we have been doing these monthly webinars for free since April. So we are on our 4th or 5th one at this point. And today we are talking all things birth prep and pelvic health and how collaboration and care between your wonderful chiropractor and your wonderful pelvic health therapist can come together and really kind of optimize your pregnancy journey. And this talk in particular is super near and dear to my heart for a couple of reasons. One, I'm 35 weeks pregnant. Two, Victoria is a personal friend of mine and my own chiropractor. And I can't swear by her enough. I can't swear by even her husband enough. My husband saw her husband today. I just think it is so important to have the right people on your healthcare team. And so we're going to dive into what that actually looks like, especially specifically for pregnancy. So again, if you have questions as we go along, make sure you go ahead and drop them in the chat and see how it goes. Okay, we'll get everything answered. So again, if you missed it, my name is Jen Morgan. I'm a doctor of physical therapy. I specialize in pelvic health, all the things, adults and pediatrics. Got some fun specialty training. I have a clinic in Guilford and in New Canaan. And I also am a teaching assistant within the pelvic health community. So I really love pelvic health rehab. And we're gonna let V introduce herself here.
And that's me. So full disclosure right now, I am so tech unsavvy that I actually can't see any of you or Jen right now. All I can see is this shared screen, but that's okay. Maybe that's better for us. I'm Victoria Chamberlin, and yes, Jen Morgan and I have an amazing history together. I cannot speak highly enough about Jen. She treated me throughout my whole pregnancy. I have a 2.5-year-old right now. And it is an absolute honor to be Jen's friend, but also her chiropractor. I have a DC, so a doctor of chiropractic. That's a 4-year degree, postgraduate degree. I am Webster certified. So that means that I specialize in a very particular technique that helps with the pregnant pelvis and pregnant people and helping you reach your goals by balancing out the pelvis. And then I also work a lot with pediatrics. So I've got a lot of very gentle techniques under my belts. I've worked for additional thousands of hours towards a diplomate degree in pediatric and perinatal focused techniques. And then also, side note, not that cool, but kind of cool. I've been practicing teaching yoga and Pilates for a very long time. So I can, I feel my body, I know my body. And so I feel like I can sort of commiserate, like we're all human beings, really. And finally, I'm certified in the Body Ready method, which is formerly One Strong Mama, which some of you may have heard about. It's very cool. It's a wonderful addition to what I do as a chiropractor. So there, and we'll get into that later, but there are different things that we address in the Body Ready method that's again a really nice addition to what I do as a chiropractor.
So what are we going to cover today, right? So here, if you can walk away with these 6 things, we are going to consider it a win. First and foremost, what is a chiropractor and what is a pelvic PT? What specialty training should one have to address the concerns during pregnancy, right? Because you can't just go to like a regular physical therapist or chiropractor off the street during pregnancy because they don't have the hands-on techniques that you may need. 2, what types of conditions can we treat? 3, what to expect during the timeline of pregnancy from a rehab standpoint. From rehab also meaning chiropractor, we're really 2 sides of one coin, which you will come to find out. 4, holistic approach to optimizing your birth. 2 sides of that same coin, what the PT going to do or an OT going to do that specializes in pelvic, as well as your chiropractor who's Webster trained. And then what does collaboration and care mean? Now, collaboration and care, we're really going to speak to what we do because we specialize in collaboration of care all the time. But then this is also something that can get your wheels turning about like, okay, cool. If I get my own chiropractor or pelvic health therapist in my area, what can I expect from the 2 of them? And then also resources and support. Cool. B, go ahead. What is a chiropractor? What should we be talking about? What should we know?
Yes. So great question, because I feel like this can be polarizing in a certain way. It can be misleading in a certain way. A lot of people think chiropractor, neck pain, back pain, cracking, popping, snapping, blah, blah, blah. Yes, that is some of it sometimes. But really, like, what we're doing is getting to the root cause of what's going on. So we're essentially restoring balance to your nervous system. The nervous system, the brain, and the spinal cord affects literally every single thing that your body does. And so if there are restrictions in various areas of your structure, we can release said restrictions and, in various different ways, and therefore help one adapt much more better and much more optimally to whatever's going on. Life is long and hard, and we have lots of stuff going on every day, whether it be the big, big, big things or the little things like, oh yeah, like I drink soda every day, just everything kind of adds up. So we are helping the nervous system better adapt by releasing restrictions to whatever's going on, specifically for pregnancy. And we'll get into that a little bit later, but specifically for pregnancy, we're looking at the particular structures that are holding baby in place. In terms of what a chiropractor is, that's like the grand umbrella. And there are lots of different types of chiropractors. There are lots of different types of specialties. We've even got, same with PT, right? We've got people who work with neuro, people who work with ortho, people who work with various different things. So, so again, a chiropractor is what this slide says. But I would also say, do your due diligence and find the right person for you. If it's not vibing for you, then find somebody else. It's not that there's no shame in doing a little shopping around, because everybody's a little bit different.
Totally. Okay, so what's Webster training?
Yes. So the Webster technique is a very specific technique for the pregnant pelvis to help balance the bony, muscular, ligamentous structures of the pregnant pelvis. So what we want to do, I brought my pelvis. So what we want to do here is we want to have a Goldilocks pelvis, not too loose, not too tight. We want just right. And so myth busted, this is not a basketball hoop. It is freely movable. You need to be able to, if you're planning on having a vaginal birth, have a baby come out of said pelvis. That's not to say that the pelvis needs to be balanced, whatever type of birth you're having. But the Webster technique specifically does this. It addresses all of these structures of the pelvis and the spine to make sure that baby is in the ideal position. Whether you're having a vaginal or cesarean birth, that doesn't matter. Baby should be in that right position because it's more comfortable for you and it's more optimal for your nervous system, right? So we want to make sure that all of those structures are being, for lack of a better word, balanced. And I can't say it enough because my practice is called Back to Balance. But yes, so you might have heard these buzzwords, Webster, through various people like your OB, your midwife, your doula, what have you, because there's been an awful lot of research done about particularly the flipping of breech babies, right? Like we as Webster certified practitioners absolutely do not flip the baby. We have nothing to do with your baby. We're working with the pelvis. But a lot of docs will tell you that really some of the most optimal ways to get a baby into the optimal position is one, chiropractic work, specifically Webster, two, spinning babies, which I'm sure you've all heard about. But again, that's working on balancing all of these structures, right? Because like I said, life is long and hard. We get into these patterns, and sometimes that's not super ideal. So like we've got a pelvis, little bit asymmetrical. So that's a little harder for baby's head to kind of come down and engage. So what we want to do is make sure that everything is balanced and supple, so that, again, baby's in the right position, but also some lovely side effects, if you will. You're much more comfortable. You're much more mobile. You're potentially sleeping better. You're potentially not having as much constipation. For those of us who have been pregnant, it's amazing, but it's also not super comfortable at times. So we've had, reported much more comfortable pregnancies where people are able to do what they want to do for a little bit longer throughout their pregnancies. Yeah, so, and we can certainly take questions later, but.
Yeah, I love it. Okay, body ready. So now how is this different from chiropractic and how do they blend together?
Yes, wonderful. So the body ready method, again, once formerly One Strong Mama, this was designed by, I'm sure you've heard of Spinning Babies. So Gail Tully, who was a doula, and so she, as well as a pelvic floor and core specialist, as well as a former doula, kind of all got together. And I'm so sorry if you can hear all this wind, but all of a sudden the wind just picked up, and I hope it's not too loud. But they all got together and really kind of developed this incredible method where there's a lot of research put into it to figure out what we need to address within just not the pregnant pelvis, but the body as a whole. So we're looking at upper body mobility. So for example, when you're sitting at a desk all day, a lot of it is going into this. So therefore we've got, like most of us are probably doing right now. So there's a lot less, there's a lot more restriction up through here, and then some overstretching of the upper back muscles, right? So what can happen there is that when you're growing a baby in your uterus, there's a little bit less space. There's a less optimal space. Core, obviously super important, because we can't have, again, we need Goldilocks core, not too tight, not too loose. Pelvis, I just mentioned the pelvis with the Webster technique, but again, we want to have everything balanced and supple so that the joints can, and muscles and ligaments can move and yield in a way that allows, yes, pain relief, but also optimal functioning. Pelvic floor, obviously, Jen is the expert in this, but pelvic floor needs to yield, right? It can't be just a trampoline that baby's bouncing off the walls on. So we address certain things in terms of that, and then movement patterns so there's a few things that we look at in our initial intake to see what's going on, see what your patterns are, and we'll give you specific tailored things, movements, exercises, positions, and then in my case, particular hands-on body work to work on things that you specifically have going on. Also, the Body Ready method has phenomenal education for childbirth. So I'm very, 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 very passionate in terms of getting you ready to have the birth you want or that you're planning for. Again, either vaginal or cesarean, because all of this, getting the body ready for all of this, I mean, it's a marathon. No matter how you have your baby, it's a marathon. So we want to make sure that all systems are go, as well as the fact that we need to not be in sympathetic overdrive, not be in fight or flight, right? We want parasympathetics to be able to take over when they need to take over so that we can do this as efficiently as possible. And then therefore, after this is all done, again, regardless of the type of birth you have, that you heal in the most optimal, ideal way possible.
Love it. Okay, so kind of talking about pelvic rehab, like if you've been following around for a hot second, you may know about pelvic rehab. I hope you know about pelvic rehab, but pelvic rehab is a non-surgical approach to treating pelvic floor, right? So we're talking bladder, bowel, sexual dysfunction or function in general, any sort of pregnancy, postpartum, ache, pain, just preparation in terms of wellness. We really are focusing on your musculoskeletal system as well as education to empower, right? We really want people to be able to advocate for themselves. And at least at our practice of Centrality, we really focus on keeping you strong. And then once you get closer to that like third trimester, we start talking about like all of the push prep, all of the fun stuff that's going to happen with labor and birth. And then we're really big on collaboration and care. And so if you don't have a chiropractor, we're going to find you one. If you don't have a doula, we're going to find you one. If you're not feeling heard by your, midwife or your OBGYN, we're going to talk about it. So pelvic rehab is a lot of movement, hands-on stuff, looking at your muscles, your bones, your nervous system, and lots of education. And I feel like the best thing about finding collaboration and care, and again, we're going to touch on this later, is that every time we hear something, you only hear about 30% or retain about 30 to 40% of like what you hear. So when you have multiple providers who really are on the same page and understand all their information, they know their scope, but they also know how they weave into that like basket of like trying to protect your health and taking care of yourself, you're going to hear things again and again, and then you're going to be able to regurgitate and also absorb what works for you and be able to like empower yourself in your educational bucket, if you will. So again, pelvic rehab, focusing on mostly the muscles and then a lot of education as well. So who is a pelvic health provider? Now, at Centrality, right now, we are all physical therapists. We are all doctors of physical therapy. We have thousands of hours of continuing education to become pelvic health specialists, because just like Dee said, if you're a chiropractor, that doesn't necessarily mean that you are Webster trained. If you are a physical therapist, that doesn't necessarily mean that you are a pelvic health therapist. Now, you also can be an occupational therapist. So at the end of this presentation, we're also going to give you resources to find someone close to you. And if you look and it says PT or an OT, and they're on that website, that database, that actually means that they still have taken the training that they need to be a pelvic health specialist. And again, being a pelvic health specialist, you want to make sure that they've taken multiple layers of coursework. They've taken bladder and bowel work, they've taken pregnancy work. And these are some of the questions you may want to ask when you call up the office, like, hey, I'm 35 weeks pregnant and I'm having some like really gnarly pubic symptoms pain when I roll in bed at night. Like, is this something that you guys see in office? That's literally something I'm having right now. So like, that would be a question I would ask if I was going to call, because you want to make sure your people treat what you want them to be treating on you, right? You want them to be comfortable and a specialist. You're looking for the most specialized team that you jive with, and just so you're going to feel really supported in your journey. So common pregnancy changes. Now, V touched on a lot of this already. Think about what happens to the pregnant body, right? So we take what it looks like straight lines, right? If you look at the front line, back line, and then we start turning things into globes, right? So we're starting to make a lot of space, especially in that anterior, that front line. And then it's going to impact everything, because if everything kind of gets shifted forward and pressure kind of gets put down, especially as baby starts to get lower in that third trimester. So things that can be impacted, your mid-back, like in between that shoulder blade region, right? Feeling really, really tightened through there. Your chest, right? Because sometimes we get pulled forward, and also breast tissue growth. And so everything may feel a little bit heavier. Your transverse abdominis, as well as your six pack, not on here, but your rectus abdominis, all of those things are going to, again, be lengthened to accommodate. It's not a forever state, it's just a now state. Glute max and hamstrings get a little tight to try to support what's happening in the front of your body. Glute med, so when the outer hip muscles start to get weak, maybe we waddle a little bit, right? So we're starting to notice maybe a little bit of weakness in there. Hip flexors, and then pelvic floor. Now, pelvic floor, signs of weakness, leaking with coughing, sneezing, or laughing, or getting up out of the chair, feeling pelvic pressure or pelvic heaviness. That's earlier in your pregnancy. If we're having any sort of issue with like pelvic pain, that's also a sign there's some pelvic floor stuff going on. Now, of all of these muscle groups, I mean, you probably address all of these muscle groups, but like, do you find that there's like a commonality of like which group you see the most? Like, do you start with a lot of like mid-back stuff? Is it low back stuff? Like, what do you typically see?
It all seems to kind of come together, and it usually is like somebody will come in with sciatica at first, and then enough history questions have been asked, and what we realize is like, oh yeah, my ribs feel really sticky or loose, so yeah, my upper back is really bothering me. Obviously, like the core situation is a completely different situation because the core needs to yield. But yes, subsequently that can cause a lot of back pain. What I hear all the time is I'm sleeping like garbage. And it's like, I know, I'm sorry. I know. So trying to figure out ways to help support various muscles that are either over or underworking. There's also like pubic symphysis dysfunction is a real thing, obviously. And Jen, I know you see that a lot too. So there's those pelvic floor issues, but there's also just the pubic symphysis. So this is the pubic symphysis right here. So this is, and again, it needs to be Goldilocks, not too loose, not too tight. It needs to be able to yield. And so with pubic symphysis dysfunction, it is a joint issue as well as a ligament issue, as well as a muscle issue, but we see that a lot. And then tight hip flexors. So fun fact that hip flexors are directly related to that sympathetic overdrive symptom. So when you've got super, super tight hip flexors, everything else is not necessarily getting the cues that they need to be getting. So it's also kind of when you've got a baby in the way, if you will, you're like, oh, like, well, how can you tell that my hip flexors are tight? But in fact, it is potentially the position of the baby that's causing a tight hip flexor, right? So we see a lot of that. And then of course, mid back chest, that ends up getting worse after baby. We can talk about that later, but it's all absolutely related, because if you think about it, we walk through life normally sort of like this, and then inadvertently we just end up, you can't see me like perfectly right now, but inadvertently, like, we're going into a hyperlordotic curve with muscles really doing a lot of work to try to hold us up. So yeah, a lot of the waddling. I mean, I was a waddler. I was a waddler. You helped me a ton with that. So
totally.
Yeah, we see it all.
It's interesting because also, like, when we talk about it all being connected, like, as I mentioned earlier, V is my chiropractor, and I have a lot of constipation in my history, like from childhood. And every time V works on like my hip flexor, so hip flexor actually attaches in this like upper lumbar region and then comes forward through your body. So you can kind of see my cursor through your body to attach to the front of your hip. And where that high lumbar, L1 through L3, L4, that's also what innervates your colon and like your digestive tract. So when we start thinking how everything's connected, when somebody's like, oh man, I'm having constipation and I'm having hip stuff, it's all connected. So you want someone who's gonna be able to look at all of those things.
That being said, let me just jump in here for a second. The jaw and the sacrum and the pelvis are directly related, right? So I see a lot of new TMJ issues during pregnancy. And again, totally, I've never had jaw stuff in my entire life. When I was pregnant, I did. And within the body, the jaw is actually directly related to the sacrum and the pelvis. So again, sacrum is this little keystone, big keystone bone right here. And so when there's something going on in one area, there's usually something going on in the other. And oftentimes with pregnancy, it's a pelvis thing that then manifests itself right up in here.
Totally. And if you haven't Googled what your vocal cords look like, go look at them. They look like a vagina. Fun fact. Okay. So we kind of touched on this, right? So what types of conditions do we treat? I'm going to let V take this slide first, because this is actually what the chiropractic slide looks like. And then I actually have another slide too, but you're going to see a lot of overlap. So V, conditions you commonly see. Go ahead and take it away.
Right. So like I mentioned, sciatica is kind of like a funny, like bunk term, because everybody has sciatica, and it's, it's not like a diagnosis, but it is in the books, it's a diagnosis. But sciatica can be anywhere from like, oh, my butt hurts just kind of right here, or like I'm having radiating nerve pain down my leg. Oftentimes it can come from the lumbar spine, but it can also come from really tight piriformis muscles. Round ligaments. Fun fact about the round ligaments. You can't see can you see my cursor? No, right?
No, I don't think so.
Okay. So the round ligaments are what holds your uterus in place, but they have muscle fibers, which is unusual for ligaments because most don't. So usually when the uterus is having a growth spurt, so oftentimes I see this in first and third trimester, the round ligaments can get this really sharp kind of like tinny. I don't know if that makes any sense to anybody, but like hitting a tuning fork type feeling. So we'll work with round ligaments, and the cool thing about round ligaments is that they do have muscle fibers, so you can fairly easily let a spasm go away by body work, either by me or like you can even rub it yourself. Reflux heartburn, what a pain. Not everybody goes through it. Usually in first trimester, it's a chemical thing. And in second and third trimester, it's a space and structural thing. So that the baby is shoving your stomach right up through your esophageal hiatus and causing reflux and heartburn, which I had never had in my life until I was pregnant. So if you've had it, you know what it's like. You've got that lump in your throat. You can barely swallow. So we see a lot of that. Rib pain, the rib heads. So I don't have a spine here, but you've got your spine and you've got your ribs, and the rib heads, the attachments of the ribs are very narrow. So when there's a lot of real action in the body, the ribs can just kind of slide in and out, especially depending on what you do for work. So again, if you're hunched over a computer all day long, your ribs are just sliding mostly out, and it's kind of hard to let them do what they should do normally. So I see a lot of rib pain. That also being said, anterior rib pain in the front, right? When everything's being pushed and pulled forward, you've got that costal cartilage pain. The headaches are an interesting one. Oftentimes it is chemical and hormonal. And that being said, we can, when we're regulating the nervous system, that can certainly help, but particularly also when you get forward head posture, because your posture is changing, because you're growing a baby, you can get a lot of restriction in your cervical spine, your neck. So that can start causing headaches if you've never had them before, or make headaches worse if you've had them before. So we'll work with headaches. And then again, what I mentioned is particularly with aligning the pelvis. If your goal is to have a vaginal birth, at least in this country, in most states, your baby needs to be head down. So helping align your pelvis so that baby is in the ideal head down position for birth is obviously going to help you achieve said goal. But that being said, when you've got a head up underneath your ribs and you're being kicked in the crotch, that's not really super comfortable either. So we want to get baby's head down.
Yeah.
And then, yeah, like I said, if you're prepping for a C-section, I have plenty of patients coming for first, second, third, fourth, fifth C-sections, and they just want to be able to heal better. Then, we want to make sure everything kind of goes back where it should go. And again, because of the changes during pregnancy, you've got a lot of hormonal changes, you've got a lot of relaxin in there. We want to make sure that the muscles, the ligaments and the bones are doing their jobs correctly.
Totally.
Oh, sorry. And the TMJ stuff that I mentioned as well.
Yes. So looking from a pelvic health standpoint, we get a lot of people in our door for the same thing, right? Like this list is going to look super redundant, right? And that's intentional, right? We already talked about that pubic symphysis, that cartilage in the front, diastasis recti, which this picture here is what you can see, a diastasis where the abs slightly widen, right? This is actually a protective mechanism in pregnancy. This is not something we are going to try to control. We're going to work on our coordination. And typically postpartum, this is going to reorganize itself and we may just have some weakness afterwards, but we see it in pregnancy often. Sciatica, which we already talked about, round ligament pain, pelvic pain or heaviness, and this can come from like prolapse or even vulvar varicosities or just like fatigue. If your pelvic floor is really weak and tired at the end of the day, you may just feel heavy. Any sort of incontinence. Now, fun fact, if you have incontinence in your pregnancy, there is a high likelihood that you will have incontinence after birth. Now, a little bit after birth is very common. We're talking the first like 4 to 6 weeks. We want to see it resolved. But if you have it in your pregnancy, it's actually very common to still have it afterwards, after that window of time. We do a lot of tailbone pain because all those muscles that are starting to yield are going to pull on that tailbone space and potentially start to cause a little bit of discomfort. Labor and birth prep. This is one of like the keystones I feel like we see at Centrality. And then foot, neck pain, other orthopedic stuff, mid-back, jaw, a little bit of jaw. But we typically see we're working basically from like neck down a little bit. But lots of redundancies here, which is why we are going to find that multiple people working on the same area is going to be the most beneficial. So we're going to cover real quick. So I get the question all the time. Well, when should I start pelvic health PT? When should I start chiropractic in my pregnancy? So we're just going to talk a little bit about like this slide here is about the medical model. And then the next couple of slides are going to be talking more about like the PT-DC type model. So right now, if you're watching from the United States of America, this is typically what it looks like. So first trimester obviously is between that first 12 weeks, second trimester is 13 to 27, and then third trimester is 28 to 40 plus. Now, you're going to start to see your OBGYN, your midwife, your group somewhere between 6 to 10 weeks. That's going to be your first point of contact. They're going to confirm your pregnancy. They're going to have you pee in a cup. They're going to make sure that all is looking okay at that point. Then for the remainder of your first trimester, you're going to go once every like 4-ish weeks, right? Then once you hit your second trimester, you are also going to continue every 4-ish weeks, depending. You also will have your first scan somewhere in between that like first visit and like your second-ish visit. Third trimester, you're going to be seen more frequently, every other week, every 2 to 3 weeks, whatever feels good for your practice, whatever feels good for you, as long as this is like a relatively uncomplicated pregnancy, right? You're not having a ton of nausea, you're not having a ton of symptoms, you're not having a ton of pain, right? This is pretty like mellow yellow. So basically, once you get closer to the end, starting around that 35, 36 weeks, they're going to see weekly. So basically, you're going to see them somewhere around 15 to 18 times, depending on who you are, what you have going on. And so it's different. And then postpartum, you're going to see them maybe if you have a C-section, probably around like a 2 to 3 week mark. If not, maybe just at the 6-week mark and then like done. So this is really what it looks like over that 40 weeks time. Again, if it's pretty relatively uncomplicated. And in this time frame, they're going to talk to you about birth preferences, who's on your team, medications, how to manage some like icky symptoms if you're having them in the first or third trimester. And then hopefully they're going to be starting to talk about like me and Victoria and spring babies and doulas and all the things, fingers crossed, right? I know my practice did, but my practice is amazing. Actually, we have the same one, me. So, all right. So let's talk about now from a rehab or like a PTDC model. So for us in the first trimester, it's a lot of mitigation of symptoms. So first trimester symptoms, like what you may experience, swollen and tender breasts, right? This is pretty soon after conception. This is very hormonal in nature. This was actually like my first cue, truthfully. Nausea, maybe vomiting, maybe not. And you may even have like nausea to the point where like you have HG, right? Where it's so intense that you may actually need medication to help manage. Increased urination, fatigue, food cravings or aversions, heartburn, constipation, backaches, back pain, or headaches, back pain. And then we really, at least from our standpoint, we don't get a lot of people coming in the first trimester because we just tell them like, hey, do what you can. Like try to ride this wave. Yeah, your survival, ride this wave and try to be active without depleting yourself. If you're super tired, do not try to like go move your body and run. Like just don't do it. Do you find that that's the case with you too, V? Like you have people come in, you're just like, let's just manage these symptoms for the first trimester and make sure you're feeling good.
Totally. Yep. Yeah. It's survival mode.
Yeah. So then moving into second trimester, now this is different for us. Like for us, this is like ramp up of activity because there's a lot of evidence out there that shows the more active you are in your pregnancy, the better outcomes you're going to have postpartum. There's a lot of also correlative evidence that shows that you also potentially may have some better or optimal laboring time. So it might be a little bit shorter, might be a little bit more manageable if you are more active during your pregnancy. And what we mean by activity, we want to see like strength training, so resistance to keep that pelvis like as stable as it can while your body is like trying to like open itself, as well as cardiovascular endurance. So those are like the two things you really want to see in the second trimester. Also, this is a perfect time because symptoms subside, right? So you may start to see that some of that first trimester stuff is gone, which is awesome. But this is also the time where some of the conditions that we treat, those start to pop up. So you may start to be like, oh, I'm feeling a little funky in my low back. I probably should maybe do something about it and just not like blame my pregnancy, because that's what I did for the first like 13 weeks, right? V? Like people probably come to you like, I thought this was just normal pregnancy.
I feel like that's such a thing, right? Because like society and whatever social media, the world just tells us like, and some practitioners are just like, yeah, it'll go away once you're done being pregnant. And my theory, and honestly, practice what I preach. I have a 2.5-year-old and I practice what I preach. Like you don't have to absolutely suffer through your pregnancy. Yes, things are going to change. But I don't know that pregnancy needs to. I think that was a good phrase. Like we don't need to blame our pregnancy because there are things that we can do. And it's tough too, because it's like during the second trimester, you're feeling better. So you want to get out there, you want to get more active. But because, I mean, your body is not the way that it was before you were pregnant. And I think to your point also, Jen, about the education component, that's huge because we don't know what we don't know. And especially if it's baby number one, we just expect that we're just going to be able to do whatever we were doing before. And we kind of have to accommodate for whatever changes are going on. And so that being said, being able to see someone like me, Jen, and you know, various others are going to help us as pregnant people be able to get into those activities that much more effectively, efficiently, and without injuring ourselves, whether now whilst being pregnant or making something worse postpartum.
Totally. So third trimester, this is, I really feel like this is like our game day, right? Like, I feel like this is where you're going to be starting to ramp up to see V, you're going to start ramping up to see me. And at least from my standpoint, we're going to make sure that you are having a pain-free and as pleasant as humanly possible pregnancy, what we can control. But we really start to talk about all things birth prep, and we want to honor what your birth you want it to be. I believe we're going to talk a little bit on that in on a future slide, but I feel like that's really our goal. And we start to also ramp up sessions. So we're going to see someone starting at like 28 weeks, and then we'll probably go somewhere another like 6 to 8 visits in the third trimester to make sure that we are prepared for birth. Ooh, I'm just my pen in my face. And then also for the postpartum phase, we will cover education on that too, which we'll cover next. Now, I think you start to also see people a little more frequently as well in this time.
Right. We see more people more frequently for various number of reasons. Usually symptoms get worse. If your baby is malpositioned, obviously we need to ramp some of our visits up. I would say a large percentage of the time, I have people calling my office at 37 weeks saying, my baby's breech, what can you do for me? So that's why I always suggest starting sooner, because that allows your body to prep for it, right? It's not, it's not the end of the world. I've had babies move into the right position after one adjustment, which is amazing. But also being able to start a little bit sooner and allowing your body to get used to all of these various things. Because again, there's a huge education component, particularly with what I do with the Body Ready method. I'm giving you various tools along the way to help you with various trimesters, with various symptoms. And then particularly as we get to third trimester, allowing the baby to know how to, so I don't know if you can see this, but this is the pelvic inlet, right? So baby needs to be able to get into the pelvic inlet to engage. And then we need to have baby get through mid pelvis in order to birth him or herself. And then obviously the most important part is getting baby out of the outlet, right? So we do various things throughout third trimester specifically to have the pelvis inherently understand what it needs to do, so that when you are in labor, you don't have to be like, what is happening here? I'm stuck on my back. I don't know what to do, right? There are tools that you can draw from your body. Your body already knows where to go. Yeah. And so, I always suggest starting a little bit sooner than 35 weeks, because usually when you're starting a little bit earlier, also symptoms are a little bit less bad, and then baby's in a more ideal position from an earlier point to whenever you end up having your baby, whether it's 2 days before or after.
If you had to pick a number for like what number of weeks would you like to see somebody optimally? Like, what's a magic number? Do you want to get someone at like 25 weeks? Do you want to get someone at like 31 weeks? Like, what feels good?
So for me, I think optimally, like a first appointment would be amazing around between 12 and 20 weeks. So we can establish care. If you're looking for preventative measures and you're already looking ahead you're looking ahead. Obviously before then, again, you're in survival mode. And then I'm usually like, if you're not having too many symptoms, I'm like, monthly is great until we're about 26 weeks, right? 26, 27 weeks, usually around 27 weeks, your uterus is going to have a huge growth spurt. You may gain like 10 pounds in a month. And that's a lot on your body. And so then around 26, 27 weeks, we check back in, we see what's going on with symptoms. No one's going to check the position of your baby and really worry that much about it until about 33 weeks, right? And even around 33 weeks, we're not super worried about it, but then some providers won't really check much. And then they'll tell you, oh, your baby's breech at 36 weeks. You either need a C-section in 2 weeks or you need an ECV in 1 week, right? So that doesn't give us a whole lot of time to work. So then again, working with your goals and your symptoms, basically working on what you and I collectively want to do together, but really more so you and your partner. Starting at around 26, 27 weeks, we'll talk about maybe every other week. And then third trimester, weekly is wonderful. Again, if your baby's breech, we're going 3 times a week until that baby flips. And it is what it is. Like, there's a lot of stuff we need to do there. But then if you're feeling great, then cool. I will say, so I'm a chiropractor. My job is very physical, and unfortunately, and I'm like, this is where I don't practice what I preach, because it's a very one-sided job. Like, I'm comfortable working on one side of the table, right? So always doing one-sided things. So I had my husband, who's also a chiropractor. He adjusted me 3-4 times a week because I was able to have that happen, which is obviously a blessing. But I have to say, I would have been immobile if not for having been adjusted that regularly, or at least twice a week. And then, and then seeing Jen as well. I was seeing Jen, I don't even remember at this point, but I was seeing at your frequency, and that helped me significantly. But yeah, so in terms of the timing, again, we start slow and ramp it up. But if you're feeling great and you're functioning great, then cool.
Yeah.
Like you're
30,
you're 36 weeks, you're 37 weeks, your baby's been breech, your baby flips at 38 weeks, you feel amazing. Cool. Let's let it lie.
Yeah, that's us too. And I mean, I feel like we really typically start to see people around 20 weeks. We'll do an internal assessment at that point. We'll look at your strengths, and then we'll ramp up accordingly. So now let's talk about like what does it actually mean to like, what are you going to cover in someone who's like wanting pregnancy and birth prep, right? So what does that look like for you?
So Jen and I are so incredibly fortunate to have a vast and amazing network in our area of some really talented birth professionals. And that being said, I know that Jen does have people countrywide, as do I. So if you're from a different area, then we can certainly help you find the right types of people. And within our circles, we have people who are country and worldwide, right? So when you come to see me for your very first appointment, we're going to do a full health history exam intake, and previous birth history if you have one. We will get you adjusted that day, but before that, I will explain to you, if you don't know yet, what the Webster technique is, what I do, how I use my table, how I use my instruments, or whatever it is that I'm introducing you to that day. I usually, depending on when you're coming to see me, I usually won't give you any exercises that day unless you're coming to me at 39 weeks and your baby is breech. So it is kind of timing and patient dependent. I usually ask for at least one visit for you to bring your partners, or a partner, so that I can teach you a few things to, one, help mitigate pain at the end of a day, because usually that's what I'm hearing is like, I am just in so much pain and so exhausted at the end of the day. There are a few things that I can teach you, your partner, to do that will help you at the end of the day, and then subsequently help get your pelvis ready for birth. And then really the first question is, how are you? But, but then also, what are your goals? And absolutely no judgment, I support you and your goals, and I will do every single thing in my power to help you support what your goals are. I will put you in touch with the right people. I will educate you as much as I can possibly educate you based on what I know about what your goals are. And so really that's the main thing, is helping you achieve what your goal is for your pregnancy, for your birth, and for your postpartum. The first appointment, or is there a first appointment slide?
Yeah, you have that coming up.
I'll go over that later.
Yeah. So on the pelvic PT realm, pelvic PT OT focused, at least at Centrality, when it comes to birth preps, when you start hitting that like 33, 4, 5-week mark, these are the things that we are going to really start honing in on, right? We want to start talking about your hip mobility and how that relates to the stages of your pelvis. So we showed you in that pelvis, the inlet and the outlet and the mid pelvis. So we want to start educating you how your hips play a role in that, how your pelvic floor plays a role in that. And we're going to give you like drills to be doing at home. So you're going to be doing like mobility stuff, as long as it doesn't flare symptoms. Now, we also are going to start talking more about internal pelvic floor work, right? Perineal massage work. What is that going to look like from a homework standpoint for you? Because you really want to make sure that that pelvic floor not only is stretchy, right? Because your pelvic floor really has to kind of move around the baby so that the baby can exit. But also, I find perineal massage work, when we come in, it is good to start to desensitize some of those nerves that kind of weave in between your pelvic floor that can actually start to create that ring of fire that people talk about. It can also be a shock to your nervous system. So we don't really want to see fight or flight. We want to stay in that rest and digest. Now, we're also going to talk a lot about what happens with a C-section. What types of things do we have to consider with nerve desensitization, breath work? We're really going to kind of dive into more of the abdominal work too. If you know that that's the route you're going to go, truthfully, I prep every single person for C-section and for a vaginal birth, because sometimes birth is unpredictable and we don't know. So you're going to get all the education. And sometimes they'll look at me and say, I don't want that. And I said, cool. I respect that. And if you change your mind, please let me know. But a lot of people are open to it because they're like, I just want to know what I don't know. We're also going to do a lot of education on laboring positions, aka also birth positions, because you can labor and birth in many different positions. And I do a lot of talking with my patients and with their partners or their care teams about how do you navigate hospital systems, birthing centers, other types of places that you can birth, and how do you have conversations about maybe you don't want to birth on your back, maybe you want to be in a tub, like what does that look like, and how do you maybe like kind of close that gap as a patient, because sometimes it can be really hard to advocate for yourself. We talk about pressure management and birth, so like what does it look like to push, talking different types of pushing, talking different types of breath holds or not breath holding, right? So all those things are really important. We demonstrate it in session, so sometimes it's a little funky, but we talk all about it, and you feel a little bit more prepared when you can practice. And then pain management strategies and partner support during labor and birth. And again, just like Dee said, our goal is to get you the birth that you are wanting, and also to really be flexible as well, right? So sometimes I really feel like birth plans, they get this rep of like, I'm this person. I don't have a birth plan right now, guys. I'm just going to say it because I'm someone who's so type A. I will be stuck in my plan. I just need to know, here are my options. Here's what I would like to try. And if it doesn't go my way, I just need to be able to roll the dice and figure out what's my plan B, plan C. Let's be flexible. So I really try to remind people, plans are hard and rigid. Let's try to be super educated and knowledgeable and see how we can use all the tools in our toolbox. Okay, so V, first session with you.
Right. So first session with me is about 40 minutes, give or take, kind of depending on what you've got going on. I mentioned a little bit about before, we're going to do a full health intake, any kind of birth history that you may have. Even like some of the most random things that you would never have thought about before. But for example, there's a question on my intake. Have you ever had a LEEP procedure? And a lot of people have had a LEEP procedure back in their teens and 20s and then completely forget about it until that question is right there, because that can inform a lot about what's going on with your pelvis right now. And then I will give you, educate you again about what's going to happen on my table. I will work on you. And then in terms of coming into my office, we are a very family friendly office. It is truly my husband and I, we're a small family run business, and then my wonderful receptionist. And we invite, you can, if you've got kids, please feel free to bring your kids. I don't ever want childcare to be an issue. I've got a private nursing and changing area in the back. This is usually for postpartum, because, I'll treat you throughout your pregnancy and then you come in for your postpartum adjustment. And my goal is to also be able to make sure that baby is okay as well. And then there's some privacy in the back so you can take your time and nurse and change if you need to. So with that first appointment, we're together for about 40 minutes. And then, again, kind of depending on your schedule and your partner's schedule, the second appointment is about 30 minutes, and we'll go through a bunch more education based on what I have found in my first appointment with you, how you felt after your first appointment with me, based on, various goals, where you are in your pregnancy. Because again, people are coming to me and Jen at various different parts of times of our pregnancy. So a lot of it kind of hangs on that. And then that second visit, or sometimes third, depending on, if you've got the time, we will go over a bunch of education. I will teach you and your partner some various things. And then the subsequent appointments after that, if you're just coming in to get adjusted, that's 15-20 minutes, easy peasy. Usually, rest assured, I don't rush through it. I am never, your time is very valuable to me, so I will never rush you through an adjustment just to get you out of my office. Absolutely not. We're going to work on whatever you're coming in with that day. So like, hey, guess what? I felt amazing the past 5 adjustments, and all of a sudden I woke up this morning with carpal tunnel. Can you do anything for my wrist? And so absolutely, we will address whatever's going on with those symptoms. So again, first and second appointments are longer, and then subsequently they get a little bit shorter. But it's never like wham, bam, thank you, ma'am, goodbye, get out. And true. As Jen said, there's education along the way, right? Like I always come back to, we don't know what we don't know. And usually there's like something that'll like be a buzzword or a trigger. And it's like, or, towards the end, it's like, God, I really don't want to be induced, or I'm really nervous. And that's another chance to bring another education component in, like, hey, have you heard about prostaglandins and effacement? So, there's education along the way. We can't do too much too fast because our brains just can't handle it. So, similar to Jen, we're educating along the way based on what you've got going on, where you are in your trimester.
Totally. Now, again, I look very similar on paper in terms of what you get from an evaluation or first session with me. Our first sessions are 60 to 90 minutes. They're pretty long and comprehensive. And again, some of it also depends on where you are in your pregnancy and how much time we're going to need and how much we got to do. Follow-ups will also be an hour, always, one-on-one with me and you, with your therapist. We've got multiple pelvic health therapists who specialize at Centrality. And you typically will find, at least in the pelvic health realm of PTOT, that you're going to be roughly in that 45 minutes to an hour or more, depending on the practice setting. Now, we take a subjective history. We got some weird questions on our intake too. Sometimes people are like, I don't know why you're asking me this, like childhood constipation or falling on my tailbone that I can recall like not being able to get up. Yeah, those things all matter, right? We'll review pelvic floor anatomy. We'll talk about what an internal pelvic floor muscle assessment is going to look like. Typically, it's vaginal. If you're watching this and you are someone's partner who don't have a vagina and you wonder how your pelvic floor will be checked, that can be rectal. You can also decline this too. It's not something that has to happen on the first day. We're going to look at your posture, breathing mechanics, rib cage. We're going to screen hips, low back, pelvis, ankles, literally everything under the sun. Talk about what your goals are, talk about who's on your team, figure out who else you need to be adding in to spice up your life, give you the support. And then we're going to talk a lot about what we think is going on, what areas we need to strengthen, what areas need to be more mobile. We're going to give you homework. Everyone goes home with homework and figure out like what your plan will be. We always like to lay out at least 3 to 4 sessions so you know what's coming up. You will always know what your next session holds. And then we'll make sure to get you booked accordingly, right? It might not be, we typically don't even see people like once a week to start. Typically you're going to be like monthly, and then we'll space you out or make it more quickly as you get progressively further along. So this presentation is about pregnancy, but I just wanted to throw in here because V and I do a lot of talking about postpartum because we are also in our pregnancies wanting to future cast and think about what resources do we need postpartum? How can we support our recovery? Truly, in my heart, this country, America, United States, we don't do a good job taking care of postpartum people. And it's really important that this conversation starts in pregnancy, and it actually can be seen. You can be seen sooner. You don't have to wait till that 6-week mark. That's a bogus number, in my opinion. I understand why they do it. We do want to rest and heal, but if you're having leakage and pain and issue, you can actually see V or me sooner, right? Typically, we see people somewhere between like 4 to 6 weeks. We have seen people in their second week because they're having so much pain. V can see people like 1 to 3 weeks, right, V, depending on what they got going on?
Absolutely. Yeah. My husband adjusted me 2 days postpartum. I adjusted my daughter 1 hour postpartum. It's obviously a different type of body work. It's very, 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 very gentle. We're not going internal. And subsequently I'm working as gently, if not more gently than I was on you during your 3rd trimester, because if you're having a vaginal birth, or even if you end up being in labor and then having a cesarean, it's a freaking marathon. Your adrenaline is going like crazy. Your body is going through an awful lot. Never mind the hormones that are happening, whether you're nursing or not. There's an enormous change that happens all so very quickly. You've got 10 months, really not 9, 10 months, 40 plus weeks of a pregnancy to get to where you are. And then all of a sudden you're supposed to bounce back. There is no bounce back. That's not a thing. You are postpartum for life. And at the very least for 2 years. And there should be more, we should be talking about this more. There should be more education about it. Because it is absolutely not only acceptable, but so common and normal to feel weird stuff 1 week, 2 months, 7 months, 2 years postpartum. It's all so normal. And I mean, I'll just anecdotally give you my experience. I stopped nursing after 13 months. That's when I had my postpartum stuff. 13 months. My daughter was 13 months old. And I was like, what is going on? So again,
Mhm.
a lot of education component, but yeah, you're postpartum for life. So we want to take care of you, and make sure that
Totally.
that you're good.
Yeah, it's
from
really,
not
really
just
important.
from not just 6 weeks, right? So again, really no contraindication for me because I work on you where you are. If you have a cesarean and you're not comfortable lying face down, obviously you're not going to probably want to come in, but we can do other things, if that's something that you want. But
Right. And we start working on core and strengthening and reactivation and coordination and connection with your body literally within the first and second week, getting out and taking walks, talking about signs that you're doing too much. These are all things that you can start soon to build your fundamentals, your foundation. Now, especially things to consider after a vaginal birth, right? 85% of people have some sort of tearing, perineal tear. Most of the time it's grade 2, but this is definitely something to consider. We want these wounds, because it is a tear, it's a wound, to heal as well as the wound that's on your uterus where your placenta was, right? So we want to make sure that we do have a good balance of like rest, digest, recovery. So like nourishing that nervous system as well as reconnecting with your own body and with your own system. So we want to make sure we're paying attention to urinary fecal incontinence, pain with sex, any sort of prolapse or heaviness, diastasis recti, low back pain, hip pain, or weak abdominal muscles. You're going to feel funky, but there are things that you can do sooner than probably you think. And so reaching out to your team is going to be crucial. Comparatively, C-section, right now, C-section rate in the United States is about 30%. So, that's a number where you probably know someone who's had a C-section, right? It's not a tinier number. And we want to start thinking about desensitization of the nerve. We want those nerves to start, coming back online and your brain is connecting with that area. Eventually working on the scar tissue to make sure that we're supple and mobile and not feeling super restricted. And then making sure that we are not feeling any sort of like tugging in our low abdomen or our low back, and making sure that's not really playing a role in incontinence or prolapse or other issues. These are all things that you're going to be educated on at the end of your pregnancy with V and me, and then hopefully knowing what your plan is going to be as you move forward into that postpartum window of time. So these are just things to be aware of. I know this isn't what today's talk is, but just things to be aware of. So postpartum rehab, this is just a quick glimpse. I'm not even going to cover the slide, but just a quick glimpse of like what it could look like, right? We're going to educate you on like nursing and feeding and carrying and managing your constipation and staying mobile and staying strong. And please don't go back to running at 6 weeks. That's all I'm going to say. That's my only plug.
thank you.
Please don't do it.
No, and there's like that whole like 6 weeks thing. It's like it took you again 10 months to get there.
Yeah.
Don't expect to 6 weeks be back where you are. It is absolute, like we need to rehab.
Yeah. 100%.
And also, lest we forget, we also now have a child.
Yeah.
So there's that.
You are literally taking care of another human. So keep that, or maybe multiple humans. So keep that in mind. Yeah. And your body is focusing on sustaining their life and taking care of them, waking, sleeping, all the things, not necessarily nourishing you as the same as it usually has.
And then just from the chiropractic standpoint, real quick, in terms of postpartum, yes, pelvis, but also a lot of upper back neck pain, because you're basically like sitting like this for most of your day, right? Because you're looking at your baby with a shirt underneath your chin, if you're nursing. And then as that baby gets bigger, you are holding and holding and holding. So that's where the kind of the chiropractic stuff comes in terms of postpartum rehab as well, is really addressing the upper body mobility again.
Yeah, good call. Okay, so collaboration of care. This is kind of where V and I mean, truthfully, we are also friends and professional colleagues, but this is kind of where I feel like we really can shine. So as we mentioned before, rehab, PT, OT, for pelvic health, and chiropractic care, especially Webster, they are two sides of the same coin, both addressing the nervous system, both addressing how you are feeling and hopefully moving more optimally, and also having you leave way more educated than you came in. Our goal, obviously, is to take a whole body and a whole system approach, because you are all interconnected, everything matters, and truthfully, even the smallest thing that you may think is just like, it's fine, it actually could be a bigger piece of the puzzle, and we're going to look at all of those things. Our goals are to set you up for success. We want to make sure that you build your team, right? So we want to make sure that everyone is involved, everyone's on the same page, and that you feel physically, mentally, and emotionally as prepared as humanly possible for your pregnancy, your birth, and your postpartum. And as always, we, the two of us, I can speak to, hopefully this is also what you will find if you find your own care closer to you. We collaborate and like talk about patient care often, like all the time, with permission, obviously. We have signed papers saying that we can do this. But it's nice that you, as the client, don't have to like relive your story or relive your ailment. And also you don't have to like translate like what I said to V. I can just tell V myself. Because sometimes, again, things can go lost in translation. So it's nice to be able to not have to play that telephone game when we can actually do it for you. Cool. So how do you find a Webster trained chiro?
If you are sort of in my, well, actually, not even if you're not in my area, but particularly if you're in our area, ask me. Again, as I mentioned earlier, we have a vast network of people, and I know a lot of people in the state of Connecticut so that I can certainly vet them for you. That being said, icpa4kids.com is where you can find a specifically Webster trained chiropractor. But if you have any questions about that specifically, if you're like, oh, I see these 3 people in my zip, which one would you recommend? I'm very happy to answer any questions, and Jen can share my business email with all of you. If you wanted to send me, various names, if you're looking for either you or your family member who's in Massachusetts, for example. And I can say, oh yes, I've worked with that person, or I've taken, this many seminars with that person. So the main place in terms of if you're looking worldwide is to go icpa4kids.com and do that, like find a chiropractor. That was not a Freudian slip. Chiropractor tab. And you will find somebody who is Webster certified. And I can't emphasize enough that if you are pregnant, I highly, 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 highly recommend finding somebody Webster certified. There are lots of good chiropractors out there and lots of good chiropractors who are not Webster certified, but for pregnancy specific, we go through so much extra training, and it's all very similar. So, while all have different hands and somewhat different techniques, when you're learning the same thing through the same organization, particularly the Webster technique, then we're all coming at it with the same philosophy of what your pelvis is doing. So that's the easiest way to find Webster certified chiro. And again, I am just an email away, so Jen can share that with all of you if you have any extra questions about that, or helping you find somebody in your area.
Finding a pelvic health therapist is also relatively simple. Here's the directory. So these are my top 3 in this order. This is the order I typically go in. Like me, feel free to drop me a line. I'm happy to tell you. It's a small community. It's a very small community. So if you have 3 options, I probably know one of them. So let me know. If you're local to Connecticut, hit us up, right? We have 2 locations. We're in New Canaan and in Guilford, and these in Guilford. So definitely something to consider, but this is a way to start via zip. And then also, hopefully you can read bios about people, so you can learn about them and see what they like to specialize in. Okay, this is just a little bit about us. If you want to work with Centrality, there are 3 of us. So there's me on the right. I'm looking at the screen, like, what side is this? The right side. Sharon is in the middle, and Janelle is over there on the left. All 3 of us, doctors of physical therapy, pelvic health specialists. We all treat adults. We all specialize in treating in pregnancy. So you really can't go wrong. I personally have seen both of these 2 humans in my pregnancy. I cannot speak highly enough about them. Like, truthfully, I would send my mother, my sister, any single person I know to either one of them blindfolded, and they would be fantastic. So definitely something to consider. As I said, 2 locations. There's a QR code if you want to go ahead and book. So this is just something that you have from a resource standpoint. Now for Back to Balance, I've also already shamelessly plugged V. She's also my chiropractor. They're sent for her husband who sees my husband. Again, I cannot speak highly enough of them. This QR code will take you to their contact page. So if you have questions about chiropractors that you find, feel free to drop it in that line for them, and just be like, hey, I watched the webinar and I searched my zip code and these are my 3 people, and you can put it right there in their contact page. And V, you are taking new patients from what I understand.
Yep, absolutely.
I said that on here.
New patients. Yes. And so as a reminder, I specialize in perinatal and pediatric, and then my husband
Mhm.
sees everybody else basically. So what
Mhm.
usually happens is, I see the bellies and the babies, and then the hubbies end up being like, oh, I should make an appointment for myself. So if you have any questions about any and all of the above, I can answer that for you, or I can even direct you to my husband who, treats a variety of different other conditions. So, but for the sake of this webinar, yes, perinatal, pediatric, bellies and babies.
Bellies and babies. I love it. Just another little flyer. Next chat is going to be on September 12th. Hopefully I'm still here. If not, Sharon's going to take over and we're going to talk all things lichen sclerosis and spin care. Yes, so there's that. And that's it. This is a fun one. I appreciate you all for hanging in there with us, because we can get super chatty. We love what we do, and we love to know or to inform people that this is a thing. I've had a couple of questions dropped in the chat, so I'm going to go ahead and I'm going to read them quickly. And then if you have any other questions, feel free to drop them here in the chat and we can get them answered. So first and foremost, spinning babies, ? What is it? Do you want to take this one?
Yeah, great question. So you can go to spinningbabies.com. It is an organization that was developed to help babies get in optimal positions and to help support pregnant people throughout their labors and their births. It is called Spinning Babies, not because it's about flipping breech babies, although it does, the various things on the Spinning Babies website does help baby get into optimal positioning. But babies spin. So in order for a baby, I don't have a fake baby here, but in order for a baby to be birthed vaginally, ideally their back of their head is on the left side. And so it's LOA. And so what they need to do is they need to come through, they then need to tuck their chin, and then they need to come out, and then they extend and birth themselves essentially. So so Spinning Babies is called Spinning Babies because babies spin themselves into birth. It's kind of a misnomer. I as well at the beginning thought it was because we're just flipping breech babies. But that being said, there are some fantastic exercises that really do help babies get down into a head down position, in conjunction with what I do, what Jen does, etc., to help babies get where they need to be.
Okay. What types of questions should you ask a chiropractor when you call the office?
I suppose it would be dependent on what you're wanting, right? So, if you are pregnant and you are, let's say you have back pain, you'd be calling and saying, first of all, is this chiropractor Webster certified? If not, maybe look somewhere else. Totally up to you, but I would find a Webster certified chiropractor. You can ask, do they primarily work on pregnant patients? Have they worked on my condition before? Something like, I'm pregnant and my baby's breech and I'm 38 weeks. Is it too late? It sort of kind of depends on where you are and really like sort of what you're wondering. But I would just make sure that when you're calling, again, the chiropractor is Webster certified, that they have been working on pregnant patients for a decent amount of time, that they do see this sort of primarily, not like one a week. I don't know. that would be my opinion.
That's how we are too, right? So if you're going to call a PT's office, right, you want to make sure that your pelvic health PT treats what you got going on, SPD, diastasis, if you just pregnancy wellness. We personally take phone calls often if you have a lot of questions and our front desk person can't field them. So do know that sometimes the provider can get on the phone with you, but also do understand time is very hard. So if they can't call you back, maybe email them. So it could be another option too. Yes. Okay. So next question. What are your guys' thoughts on things like the Bloom method? I want to make sure that I'm keeping up with my fitness and of course doing right now swimming and Pilates and walking, but thought something like this could be easier to transition to postpartum at home eventually. So are you familiar with the Bloom method, Dee?
Nope.
Okay, I love it. I have a lot of people who do it. It is a home-based app, I believe, and it is really focused on like that core breathing, canister.
So it's probably similar to One Strong Mama.
Probably, but it's kind of it's geared. It's for like client facing, right? So it's something that they can do from an exercise perspective from home.
Yeah.
I layer it into my postpartum rehab for people who are interested and like really want to follow an app or a plan. So I'm a big thumbs up on this.
That sounds
Yeah.
similar to me than what,
Mm.
so One Strong Mama was something that you could do. You could like buy the program and do that whole exercise program. So that sounds very similar to me, in which case I'm all for it. Absolutely. The Body Ready method has now, like One Strong Mama has a different, like Body Ready can also be like certifying people to teach various things, but it originally started as like Restore Your Core and One Strong Mama, which were these separate, which I know that you've heard about. So yeah,
Yes.
thumbs up. I think that if there are educated individuals who have great credentials and who have been working on pregnant people for a long enough time and are, have gone through it themselves, then I think it's awesome. Yeah.
Cool. I love that. All right, last question we have here. Oh no, I lied. There's two more. Thoughts on hiring a doula? And if you are not pro doula, who else would you have on your team?
Make sure your husband's not an idiot. Just kidding. Sorry. No, sorry, that was me. No, first of all, super pro doula.
Me too. Super pro doula.
Because the doula is not only there for you as the birthing person, the doula is there for your partner. I can't emphasize enough, you don't know what you don't know. My husband is a physician and still learned so much from our doula. My husband is also a man, doesn't have a uterus, doesn't know what I'm going through. So there's, and of course, like not everybody's partner is a man, but if you haven't gone through it, if you're not going through it, particularly if you're not going through it right now, so if your partner is not pregnant at the same time as you are, then there's a little bit of a communication barrier there, for lack of a better phrase, where a doula is an enormous support system to help kind of educate, communicate. And then of course there's like the birth prep, yes, but then labor. Let's not forget that when we, the birthing people, are in labor, adrenaline's going like crazy, like we're running the marathon. The partners are like, I am so tired. I don't know how I can possibly do this for longer. Like, sure, we, the birthing person, are feeling that way too, but the doula is also there to help the partner cope with that, because they're also seeing you, the birthing person, growl like a lion, writhe in pain, never seen you like this before in your life. And again, like my sweet, amazing husband, who like has seen people in pain, when they're seeing their partner in pain, they don't then necessarily know how to respond. So their nervous systems are going crazy too. So I think super, super pro doula for myself because of the education component and the support component. If you are not pro doula, then I would highly suggest at least seeking out some childbirth education classes to take together with your partner, so that, again, I'm going to be a broken record here. You don't know what you don't know, and knowledge is power. And I know that sounds so cliche, but even the slightest little bits of education that you can get from various childbirth education courses that you can take with your partner, can help you through what you may not expect is going to happen, right?
Oh, 100%. I'm super pro doula. My husband and I, we've been together a really long time, relatively, I mean, for my age. And he has worked in fitness. He has been a paramedic. He is like a jack of all trades. And I will tell you, we have a doula. I'm obsessed with her. Her name is Ashley. I'm actually going to link her stuff from Empowered Beginnings in the email that goes out with this, because she also has a lot of childbirth education courses that can be viewed online. You can take them remotely. She is dope AF. And this is literally not even a salesy plug. This is just an educational plug, because we have learned so much from her. I work in this realm and I've learned so much from her. And watching her tell my husband something that I tried to tell him, we don't communicate the same. It is what it is. We just don't communicate the same. He has walked out of there being like, oh, I really don't know anything. And I'm like, me too. I feel the same sometimes. And so it's okay to feel that way. And it's nice that he knows that Ashley will be there. We'll have that support, right, as everything goes to plan. He's also just like, I'm really glad that I won't be asking stupid questions. So I think it's going to be really beneficial for everyone involved. I'm very pro doula, very pro childbirth education. very pro building a team. Also, I would say have a lactation consultant in your back pocket, right? You want someone who's going to be amazing for that, especially if you want to breastfeed or if you want to pump or if you don't want to do any of the things. Have an amazing postpartum or perinatal mental health therapist.
Mhm.
Got myself one of those because this is like a doozy for your system, right? So you want to make sure that you're super supported there. If you can find a mom's group or like a parents group, that would be amazing. Just again, some of these things to have in your back pocket that you
And
may
your tribe.
also really just want to like build the people. If you build it, they will come.
I want to touch really quickly on the
yes.
doula thing too, which is one thing that I found very valuable. If you do plan to birth at a hospital, it is invaluable to have a doula or somebody who understands the system, because it's a completely different situation, right? Being in a hospital, hospitals are businesses. And
Mhm.
and when I will leave that there, but it's really super helpful to have somebody who's slightly objective, who's able to help navigate the system for you when you and your partner are doing this for potentially the first time or things are just going crazy.
All right, last question. How many sessions does it typically take to see improvement? I feel like this is a super individualized personal question. I feel like it depends on what you're coming in with, how far along are you, what you got going on. I typically like to say small changes, even the smallest in the first 2 or 3 sessions, right? I would like you even noticing small changes. How do you feel about that, V?
Yeah, I can never promise instantaneous relief. Oftentimes people leave feeling like, oh my God, I can't believe how good I feel, right?
Yeah.
That being said, it kind of depends on the chronicity that you've got going on, how long this has been going on, if your baby is super breech. So it really sort of depends on what you've got going on. From a chiropractic standpoint, it builds, but also, again, anecdotally, I always feel instantly better after I have had an adjustment. So at least there's that. But then again, right, like everything builds. Nothing, Rome wasn't built in a day. Your baby wasn't developed in a week, right? Like it's a process.
The process.
So yeah, I mean, for lack of a better answer, it's individualized and can kind of go anyway.
All right, that is it. That's the last question. If anyone has any other questions or you've caught the recording and you have questions, feel free to email us. Our emails are going to be on those previous slides. Thank you for hanging out with us for the last hour plus. It's been amazing. This recording will go out to you in an email tomorrow. It's not going to get done today. Tomorrow. And then we will see everyone hopefully for the next one in September. V, thank you so much. You are lovely. I'm so glad we got to do this. And I will talk to you all soon. I'll see you guys on the next one.
Thank you all so much.
Bye, guys.